Hey guys, welcome back to the channel. And today's topic of discussion is fundamentals of tooth preparation. Now, fundamentals of tooth preparation. Why it is an important topic? Because all the basics related with the conservative dentistry is situated in this topic only. Then you will ask me how? Because now what is a tooth preparation? So definition of tooth preparation and operative dentistry. Tooth preparation का definition and the definition of operative dentistry are very important definition for the Viva point of view as well as in examination theory examinations also. So what is the fundamentals of tooth preparation? So according to the student, there has been given the 9 steps in which the tooth preparation have been categorized, and the steps of tooth preparation has been also categorized into the initial tooth preparation stages and the final stages also. So in initial one there are the 4 stages, 4 steps, and in final one there is a 5 steps. Okay, so let's deep dive into it. Now, the steps of tooth preparation. So first one is initial tooth preparation. First one is initial tooth preparation, and second one is the final tooth preparation. So the 4 stages and the 5 stages have been categorized like the initial have 4 stages and the final have 5 stages. Okay, so next is in initial stage. Now what is in initial stages? So in initial stage, first one is initial depth and outline form. Now you know the dental caries. In dental caries, you know the caries eventually develop from enamel, then after dentin, and then lead to the pulp, in which the pulp necrosis or irreversible pulpitis may occur. So basically why depth is important, because in order to assess the caries, that what is the depth of that particular infection on the tooth, for which the depth is important. Now why it's a outline form is important, because in outline form, if you are giving the amalgam, silver amalgam, as a restorative material, for which its retention is also important. What is retention? So ability of a material to stay in the tooth. So accordingly the form of the tooth that need to be formed, so for which the depth and outline form is important. Now resistance and retention form. Okay, now what is resistance? So resistance is nothing but the opposition or the resistance of the material or the tooth structure to the masticatory forces that has been applied on that particular tooth. It means ब्रेक होने से बचाएगा, उसको डिसलॉज होने से बचाएगा और फ्रैक्चर होने से बचाएगा. सो दैट इज नथिंग बट द रेजिस्टेंस फॉर्म. We will see it in detail, that what is the significance, importance, all those things in the upcoming lectures. So in the retention form, then what is the retention? Basically retention means जिस भी पाथ से तुम रिस्टोरेटिव मटेरियल कैविटी के अंदर डालोगे, उसी पाथ से वो वापस नहीं आना चाहिए. लाइक यू हैव अमालगम and you have cast metal restorations. Suppose inlay cavity. So in amalgam, in cavity preparation, we give this form of retention to the cavity. So this is the retention form. Means in this way you can restore the material in the tooth, but vice versa, oppositely, you cannot take it off out of the cavity. You cannot take the amalgam. Whereas in inlay, so inlay cavity is like this. Okay, so you can keep it, the restorative material inside, or cast metals restorations in it, and take it out also. But in inlay cases or cast metal restoration, here the luting cements are used so that it cannot be taken off easily. Okay, so this is direct method and inlay is indirect method. So inlay preparation is indirect method. indirect method, and putting silver amalgam or the composite or glass ionomer cement is a direct method. So what is direct and indirect method? So direct method is the patient, whenever the patient is on the chair, you complete the whole work then and there only. But for the indirect method, you need to prepare the cavity and the cast metal that you need to give to the patient, that you need to prepare in the laboratory. So this is a difference. So now what is a convenience form? So convenience form is that आपको, इफ़ यू आर ट्रीटिंग द पेशेंट, सो आपको कन्वीनियंट क्या पड़ेगा, लाइक वाइल प्रिपेयरिंग द कैविटी आप कन्वीनियंटली कौन से इंस्ट्रूमेंट यूज़ करोगे, और आपको केरीज निकालने में और या फिर डीपेस्ट पॉइंट ऑफ केरीज को एक्सेस किस तरह से जाएगा, उस तरह से आप कैविटी मॉडिफिकेशन कर सकते हो. दैट इज़ नथिंग बट द कॉल्ड एज कन्वीनियंस फॉर्म. So basically, first one is initial depth or outline form, second is primary resistance form, third one is primary retention form, and fourth one is convenience form. Now, after the initial stages has been done, second is that the final stages. So now in final stages, first one is removal of the defective restorative material or the soft dentin. What does it mean? So it means removal of defective restorative materials or the soft dentin. It means whenever there are the dental caries, after the enamel the dentin is exposed to the caries, and in dentin there is a rough and soft caries. So soft caries अगर है तो वो आप बर से निकाल सकते हो, लाइक विद द यूज ऑफ राउंड बर. ओके, राउंड बर. And in defective restorative materials, that is if previously patient has given the silver amalgam filling, but due to some reason it got fractured, so you need to take it out also. So for which you can use the spoon excavator, or with the rotary instrument also you can take it out. So one more thing is that in order to give the retention form, you can use inverted cone shape burr. Inverted cone shape burr. Actually, the morphology of the burr is like this. So whenever you are using this burr at the base of the cavity, eventually it will create the cavity like this. So these are these. So this portion, this area, this is called as a undercuts, and it's important retention feature. Okay, so get back to the final stages. So defective restorative material or the soft dentin. Okay, then after the pulp protection. Now why the pulp protection is important? So first of all, what is the pulp protection? Because as you know, the pulp is the vital portion of the tooth. Okay, as it vital portion, it have nerves and blood vessels. Okay, and it has a unidirectional flow. It has unidirectional flow of blood or nerves, so that अगर उसको एक बार केरीज हुई तो रिकवर होना बहुत ही ज़्यादा मुश्किल हो जाता है. ओके, सो फॉर दैट वी नीड टू प्रोटेक्ट द पल्प. नाउ द इन्फेक्शन ऑफ द पल्प इज कॉल्ड एज अ पल्पाइटिस. सो इट मे बी रिवर्सिबल और इरिवर्सिबल. सो लेट्स नॉट गो डीप इनटू दैट, बट इरिवर्सिबल इज कि जो इंजरी, अगर एक बार इंजरी हुई तो वो फिर से अपन रिकवर नहीं कर सकते. एंड रिवर्सिबल इज लाइक कि हाँ कर सकते. सो बेसिकली इनेमल एंड डेंटिन इन्वॉल्व रहता है, नॉट कंपल्सरीली बट हाँ इनेमल एंड डेंटिन. एंड इसके अंदर मे और मे नॉट, सॉरी, इसके अंदर इनेमल एंड डेंटिन तो रहेगा ही रहेगा, बट समटाइम्स पल्प अप्रोच भी रह सकता है. पल्प अप्रोच. So these all are the clinical application. At the level of the second year, for the preclinical, these all things are not important, but you should know the thing or the background related with these stages or the particular steps, that why you are studying this. So that's basically important. Okay, now then after the secondary resistance and the retention form, as like earlier also, these also have the significance and the importance in order to prepare these stages. We'll see it in next topic. So external wall finishing and the final procedure of debridement and the inspection. Debridement and inspection is okay, after the final procedure like polishing and all those stuff, like you will uh, take out all the remaining cotton or excessive debris, like you will take it out. Okay, thereafter in one thing in the pulp protection, that is you will give liners, bases, varnish. Okay, so these concepts are also important. That example of that and why it is important, actually it all depends upon the remaining dentin thickness. What is the remaining dentin thickness after the cavity preparation, on the behalf of which the whether we should give the liners, whether we should give the bases, or whether we should give the varnish, that total things depends. Okay, then after, what are the material that we use? So material that we use, calcium hydroxide, okay, CaOH twice, then after zinc phosphate and uh, zinc oxide eugenol. Okay, so these are the materials. Some other restorative material that we use, that is GIC, and then after composite is also there. After the composite, uh, inlay preparation, as we already discussed also, that is also commonly used material, and silver amalgam filling. So these are the main restorative materials, or the pulp protecting material that we so far use in the clinics. So then after, once again let's revise it. So basically the steps of the tooth preparation is that, so in the steps of tooth preparation, the initial tooth preparation, final tooth preparation. In the initial one, you got 4 stages, that is initial depth and outline form, primary resistance form, primary retention form, and convenience form. In final tooth preparation stage, defective restorative material you need to remove. Then after soft dentin also you need to remove. Then after the pulp protection, secondary resistance and retention form. Then after external wall finishing, and the final procedure of debridement and the inspection. So this is all for today, guys. If you get the concept, please like the video and make sure to subscribe our channel for education related videos from the dentistry. Okay, so thank you so much for watching the video. Have a great day ahead.